welcome to our patient education session. I really apologize for the late start of this meeting or this presentation. We're having some technical issues, and we've got those resolved, and so we're here at a different location, and just to bring to you well-needed education, and as part of the Pharmacy Week recognition or celebration, Gateway Pharmacy brings to you another series of our patient education sessions. Now, Pharmacy Week started from Sunday, and it will continue until Saturday. And at Gateway Pharmacy, we welcome you to join us each evening, this evening, of course, and tomorrow evening for another session. Now, as we go through the rest of the week, just let you also know that we have discounts on some items at the pharmacy, which you can ask about, some prescription drugs, which was sponsored by Ari Williams. So you can ask pharmacists. When you come to the pharmacy, you can ask us about those, and then we'll see how best we can help you. Now, this evening we'll be speaking about a very topical issue that persons have been asking me about for a while. And this is something that we want to, a topic that we all should be aware of, and a topic that we all need education on. Even myself, I need to be educated about these things, and it's a topic that is very important to all of us. And so we just divulge and we just go into the presentation this evening. I want for you to also understand that you can also send in your questions. You can send in any requests, ask for any questions at all, and as we go on, you can make your own notes. And while making those notes, you can send in your questions on the Zoom app or on the YouTube app, or if you want to send me a question in WhatsApp, you can also WhatsApp me at 472-8218. All right. Now, so for this evening, we'll be talking about how can I improve my sexual health. Now, that's a very broad topic, and time wouldn't allow us to go through all of this for this evening. But what we will do, though, we will go through as much as possible. We talked about some stuff that is there, and try to give some guide. And we might need to have a part 2 to this topic. However, let's just start. So, how can I improve my sexual health? That's something that you should ask yourself also. What do I need to do? But before we even do that, before I even go more, let's do some definition. Let's understand what sexual health is. What is sexual health? According to the WHO, it's a state of physical, emotional, mental, and social well-being in relation to sexuality. All right? It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free from coercion, discrimination, and violence. So see, that is a mouthful, that's a lot. No pun intended, but that's a mouthful. Now, so if you examine the definition here, it speaks about emotional, mental, and social. These 3 key words are very important in improving our sexual health. So, from looking at this definition, then let's divulge a little bit into what are some of the factors that may affect one's sexual health. Now, these are just some factors. I have not put everything, but these are some of the main ones that we should think about. So, when you look at it, some of these factors that may affect our sexual health are disease conditions, which we are aware of, and some of us might be aware of. Another factor is that may affect our sexual health is stress, age, culture, people around us, religion, and personal experiences. These are some factors that may affect your sexual health. Alright? So sexual health is not just one thing, it's several factors that can affect it or that may affect it. Alright? So if you're having problems, first of all, look at these factors I've just highlighted. These conditions, stress, age, culture, people around us, religion, personal experiences. So let's now go now into looking at each factor individually. And from looking at these factors, then we may be able to find solutions to them. Alright, disease conditions. Let's look at disease conditions. What are some disease conditions that may affect your sexual health? Alright? Now, hypertension is one such factor. Hypertension is a degenerative condition that can affect us, that may affect your sexual health. Not only for men, but also for women. So when we speak about sexual health, I think there's a notion that sexual health only affects, we're thinking about performance and just for the man, but no, it affects everyone. So hypertension is one such condition that may affect your sexual health. So if you look at hypertension, you can think about or look at some medications that you take can affect your sexual health. Okay? Diabetes. Diabetes is another situation that can affect your sexual health. Okay? Now, why do we, were these two conditions, put on it? It's a very popular condition. Hypertension and diabetes is something that affects a lot of persons. It's some of the most common conditions that is around, and at some point in time, you may be affected by high blood pressure at some point in time. It doesn't necessarily mean that you are constantly hypertensive, but at some point in time, you may have a high blood pressure at one point in time, or you might have a high sugar level at some point in time. So, hypertension, diabetes. Another condition is menopause. Now, menopause is a condition that can be tabooed, seems to be tabooed at some point in time, or sometimes it's tabooed, and sometimes females don't like to talk about it, and but it's something that you may experience at some point in your life. Oftentimes, we do get persons coming to the pharmacy that when they express what they're feeling or what's happening to them. So for ladies, some of the symptoms of menopause that you may have that occurs, will or may affect how you respond to your partner. For men, andropause. Andropause is a condition that affects men, and this is a situation that you may have, lack of a sex drive or lack of interest, and so that may affect your sexual health. Other conditions may include cancer. Is another condition that can affect your sexual health. Think about it. If you have cancer, you know that it plays on your mind. It plays on your mood, and it also the medications that you may be on can also affect your sexual health. Depression. Depression is another factor under these conditions that can affect your sexual health. Alright? So, if you're in a depressive mood, if you're in a depressive state of mind, depression brings on other situations. When you're depressed, your mind is not in tune or necessarily in tune with all the factors or everything that is happening around you. So when you're in this depressive state, you want to be alone, you want to be by yourself, who you are naturally becomes non-existent. And so, depression is a disease condition that can affect your sexual health. And so, looking at all of these conditions, under disease conditions, this is something that if you see any condition here that may relate to you, you should take note and make a note of it. Alright? You also should speak to your doctor, speak to your pharmacist, and see how best we can help you with this situation. Another factor that affects sexual health is stress. No, stress is a very big factor. Stress is a factor that affects all of us. At some point in time, or some point in our lives, we may be affected by some kind of stressful conditions, right? And I'm sure those who are listening now can attest to that at some point in time, you had some stressful experience, or you had some something that stressed you, and so because of that, it caused a lot of things damage you. So what does stress cause? Stress causes an inability to think and focus. Alright? Now, if you're not able to focus or not able to think or to keep your mind in how should I put it now? Keep your mind in a state where it's some kind of normalcy, then it will affect how you respond to your partner. Because you should also understand that sexual health is how we also respond to our partners. Okay? And let me say partner. So, not able to think, not able to focus. Alright? Stress also makes you feel tired. I'm sure that whenever you're stressed about something, you are tired, you are weak, you just want to just curl up and just be one place. So if you're stressed, then stress will affect how you respond, and that will affect your sexual health in some way or form. So tiredness, and of course, you need to have energy, you need to have some kind of vim and vitality. And so tiredness is something that will affect, your sexual health. So stress brings on those things. So stress brings on an inability to focus, it brings on tiredness, and it also brings on a lack of arousal, right? So when you're stressed, again, you do not feel aroused. It's going to be very difficult for you to be aroused. Okay? So we need to be aware of these. Okay? So let's go again. So stress brings on an inability to think or focus. It brings on tiredness, weakness, laziness. All of these things will happen. And also, when these things happen, there's a lack of arousal. A total lack of arousal. And so, for us to be in good sexual health, we have to get rid of stress. So we have to, no stress level here. Another factor that can affect other conditions, other disease conditions, let me not say disease condition, but other factors that may affect sexual health is age. Now, why do we say age? Alright? So we start off with look at age of consent. We know here in Jamaica, age of consent is now 16. Alright? At that age, why we say this, but your age also, if you're starting from early, your body language, understanding your body, is a very important thing. So age will affect how you understand your body. It affects your body language, okay? And that is very important to understand. As you get older, especially for those of us who are over 40, like myself, there's sometimes a lack of interest in good sexual health, or even to you want to be engaged in any kind of those activities. So your age can also affect these things. So lack of interest will affect your sexual health. And this comes from as you get age. As you get older, you will feel less interested. Right? That may happen. Let me not say it happens to everybody, but that may happen. Alright? So, and this will happen because of your hormonal production. I mean, as you get older, some of these hormones that your body produces becomes less. So we have, your testosterone levels, and you also have your estrogen levels. So testosterone is one of the main hormones, if not the main hormone, that is needed to push forward sexual interest and sexual drive. But as you get older, the body tends to produce less testosterone. So age may now become a factor as we look at how can I improve my sexual health. Of course, you can't change your age to improve your sexual health, but it's just for you to be aware that your age can affect your sexual health. Alright? Again, another part when it comes to age is erectile dysfunction. A lot of times, some men may not want to face this fact, but it's definitely true that erectile dysfunction can occur not only in older men, but also in young guys. Okay? I've seen this a lot from being in the pharmacy. We do see this happen. And so erectile dysfunction can be age dependent, and because of that fact, it will affect your sexual health. Right? That does affect your sexual health, erectile dysfunction. So if this starts happening to you, please speak to your pharmacist, speak to your doctor about these things. Again, you cannot change your age, but the factors that comes with age, we can always address. Another factor that may affect your sexual health is culture. Your culture, right? So why do we say culture? We come from different ethnic backgrounds. Okay, we now live in a world where everybody is all mixed. People coming from the Far East, coming to our shores. We are leaving our shores, going to the Far West. And each culture, each country has different culture as regards to how they approach sex. They have different culture as regards to when it comes to sexual health. So, in our culture, we may have a different understanding versus another culture that has another understanding. It doesn't necessarily mean that your understanding is the right one versus the other person. It just means that we have a different understanding. Having different understanding is nothing at all wrong with it. It's actually good to have different understandings, because when you have different understanding, it tends to widen your scope, you learn more, and so you have better experiences and different experiences. So, culture can change that. However, we should just understand that we should be able to appreciate the different backgrounds and ethnic backgrounds that each person has. Culture can also determine who leads. Should it be the man or should it be the woman? And our culture, in different cultures, some person will say the man should lead, and some person will say no, the woman should lead. But it all comes back down to culture and understanding and how we relate with each other. And that's why in the first definition, we spoke about personal personal pleasures, and so that is an important part of good sexual health. Another factor that can affect your sexual health is the people around us, and this factor is something that affects all of us. Okay, we tend to listen to our friends. So our friends may have this experience, and they come and tell you, and you start listening to what they're saying, and then now you using their advice, you listen to your friend's advice, instead of understanding your body language and your partner's body language, so that affects your sexual health. Okay? So I'm not saying that your friend's advice might be the wrong advice, but it doesn't necessarily mean that what your friends say, you should just take it. You should discuss that with your partner also. Alright? So always discuss these things with your partner. Don't just take your friend's advice as gospel, but listen to what your friends say, because we all have different experiences, and that is the truth, and that is good. Different experiences are always good. We watch movies. The movies that we watch also tends to influence our sexual health. It influences in such a way that whatever we see on the movie, we want to take it into our own scope, right? And this might not necessarily be what is needed for your surrounding. So watching a movie is fine, and watching different kind of movies is quite fine, but it doesn't necessarily equate to what's happening in the movie to bring to your own relationship. So these things will affect your sexual health. So be very careful of what you bring into your own relations. Social media. Social media is very popular now. When I was growing up, social media, we didn't have social media. And so social media is a very popular thing now. And a lot of us are looking at social media to also provide some kind of guidance as regards to how we do our sexual interactions. So, not to say that social media is bad, we're not saying that. But what we're saying is that what you get from social media, you don't just take it into your own relation and make it an issue or make it a problem to affect your own sexual health. So be careful of these things. So the people around us will have their own experience. The people around us will tell you what they're doing, and some of the times it might not be true, but it is their experience. So their experience does not necessarily equals to you having the same experience. Alright? So bear that in mind, that people around us. Another factor is religion. Some of us are very religious, and there's absolutely nothing at all wrong with this. And we know that the Bible did say marriage is honorable and the bed is undefiled. What does that mean? That simply means that whatever happens in bed between two married couples, there's nothing at all wrong with it. Okay? So, if you want to try different things, if you want to try it as a married couple, if you want to try different things that you think that may improve your sexual health, though taboo it may seem, but as a couple, you should be able to discuss, and from that discussion that you guys have, then you can always decide on what direction to go, what do you want to do, and how you can improve what your sexual health or your sexual relations are all about. So that's a very important factor. So religion, and I'm sure that this is when I was growing up that we find these topics to be very taboo religious environment, but we are all sexual beings. We came into this world because of sex, right? And so good sex health is needed. And so in our religious environment, let's not think that it is something that is so taboo that you can't talk about. But we should approach it and deal with it in that way. Another factor that may affect our sexual health are personal experiences. Personal experiences is another factor that may affect our sexual health. Okay. Now, what are these personal experiences? Sexual abuse is one. Sexual abuse will and can affect our sexual health. A lot of persons, let me not say a lot of persons, but there are persons out there who have been abused in some way or form, and from this kind of abuse, it does affect how you think, how you feel, and how you approach sex. So sexual abuse is one factor under personal experiences. If you have been abused in some way, then what you need to do, you need to get counseling. Something that you should think about and try to get sorted out. Exposed early. If you're exposed early to certain experiences, then it may affect your sexual health. So, when I said too early, let me not just say that too early, but it depends on what time or how you were exposed, then that also can affect your sexual health. And sexual abuse is one reason that may cause a person to be exposed early. Right? So we need to look at these things or understand these things. Another factor is our sexual preferences. We have different sexual preferences, and though taboo that may seem, but it is something that we have to face and it's something that we should understand. So sexual preferences can and may affect our sexual health. So after going through all of these and looking at all of the factors that may affect your sexual health, then let's look at how do I improve my sexual health. So let's look at all the factors. So we now need to address all these factors that may affect our sexual health. Okay? First of all, we did mention disease conditions. And under disease conditions, we spoke about hypertension, we spoke about diabetes, we spoke about menopause, we spoke about andropause, we spoke about cancer, and depression. These are disease conditions that we are exposed to or that may affect our sexual health. So, if you're a diabetic patient, right, and you are having problems in terms of your sexual health, then what do you need to do? First of all, we need to look at, is your diabetes under control? Are you having proper control of your sugar levels? You need to look at that. That's something that you need to discuss with your doctor, discuss with your pharmacist, right? So, what are the medications that you are taking to control your diabetes? Some medications may affect how your sexual health, may affect your sexual health also. But the first and important thing is to get your diabetes, to get your sugar under proper control. Hypertension is another condition under the disease conditions that we speak about. Is your blood pressure under control? The blood pressure is a factor that can affect your sexual health in a major way. So, are you taking your medications correctly? Are you taking your medications every day? Are you taking your medication as prescribed by your doctor? Are you following the advice of your pharmacist? Are you doing these things? If you're not, then your disease condition will not be under control. And if it is not under proper control, then it will affect your sexual health. I'm sure that you may wonder now, what are some of these medications that may affect me or may affect my sexual health? And that is something that a lot of persons tend to ask when they come to the pharmacy. Will this medication affect me? Will this medication restrict my performance? we ask these questions. These questions are asked in the pharmacy on a daily basis. And what we will say to you is that the first thing is to get your sugar, get your hypertension under proper control. Then after we've gotten those under control, then we can explore other factors that we can help to improve you. Depression is another factor. So if you're in depressive states, what can I do to get rid of this depression? Right? Now, I do understand, and we do understand that depression is not something, it's not a state that you get over with the snap of a finger. It's not a state that you get over by the flipping of a switch. It doesn't work like that. But depression is a situation that requires counseling. It requires that you get continuous support from friends and family, and good support. And that's what you need, and that's what is the important thing. If it is a case whereby you have cancer or any other of these conditions that we spoke about earlier, then once we can control these situations, once we can give proper treatment, then it will help with your sexual health. Another factor that we need to look at is stress. If you're under a lot of stress, please speak not only to your pharmacist, not only to your doctor, but also speak to your partner. Your partner is the one that will also help you to get over these stress. I'm not going to say that maybe it's your partner that is causing you to be stressed. I'm not going to say that. But that is something that you need to discuss with your partner. Because sometimes that might be the case. However, it is a situation that has to be treated. Are there medications that are out there to treat stress? Yes, there are medications out there to treat stress. But not only medications, but I will not recommend medications only, but I will also recommend counseling. Counseling plus medication is the way to go. Always seek good counseling. Once you have that combination, then the medication will work better and will work faster. Okay? So just because you're stressed, we can't just give you a tablet and stress just goes. It doesn't work that way. But guidance and counseling is what will help to control these stress factors, because stress comes from around, and stress, I was talking to a friend the other day, and he was saying to me, listen, stress is a situation that is a figment of your imagination. However, you just need to trust the process. So stress is part of a process, and so if you can just trust the process, then you'll be able to get over it. Your age. And when we speak of age here, we speak as we get older, when we're older. Now, as we get older, of course, we lose, and as we said earlier, we lose some of those hormones that our body normally uses, or that our body normally produces. So because we lose these things, then it will affect our sexual health. However, we cannot give you something for your age. But what we can do, we can recommend certain vitamins, we can recommend certain minerals that will help to improve your testosterone levels. And there are also, I have a friend that does these testosterone injections that will also help. As you get older, you may lose your testosterone levels, but you can get these testosterone pellets that will also help to improve, that part, that aspect as you get for the aged individual. Alright? So if you need information about those testosterone pellets, you can always speak to me, and I will put you on to my friend who does these testosterone injections. Alright, these are some small pellets that is injected under the skin. You won't even know it's there. But what it does, it gives you testosterone. And with testosterone, you get that boost, you get that energy. and wanting to go. They ask me to go where, but it lets you go. Culture, again, it's not something that we can control because we're living in a world where it is global. The world is not just in Jamaica, but the world is global. And Jamaicans are everywhere, we go everywhere, and everywhere comes to Jamaica. Alright? So, with culture, it's just a situation that we have to understand and just discuss with our partner, and then it will become less of a problem. People around us. Those people around us, of course, will affect, and so if we can control that, listen to the right persons. Listen to the persons who are giving you proper advice. Listen to those persons. But how do you know that these are the persons that you should listen to? Based on the outcome of whatever decision that you make. That's how you will know if this is the right person or this is the right person that you should listen to. Religion, personal experiences. We always say experience teaches wisdom. And so your personal experience will also help to guide you, again, to better or to improve sexual health. Alright? So one of the best ways to learn is from experience. Religion is a factor that we all choose. We choose our different religious beliefs, and from that, then we make decisions. So, how do I improve my sexual health? By addressing all of these factors that I just spoke about. These are the factors that affect you and that affects each and every one of us. And so once you can address these factors, then it will help to improve your sexual health. I'm sorry for those persons who thought I was going to come and tell you about all these medications and all that. It's not just about medications. It's our state of mind. Our state of mind is one of the reasons why we have problems in our sexual health. So, let's go to another slide. And I speak of man versus woman. These are questions I'm going to put at you guys, for you to answer, and you can send in your answers. So the first question is, who should take the lead? Should it be the man, or should it be the woman? You can send in your answer. Can I look at and tell them the response? While we wait for the responses, and let me just Are there anybody's responding? Anybody's afraid to respond? All right, no problem. That's fine. Let's go back to the previous slide. Sorry. And while we think about the question, we should also understand that the states, let me just repeat what the WHO had stated earlier. It's a state of physical, emotional, mental, and social well-being in our relation to sexuality. So, after looking at that, then you can think, who should take the lead? Should it be the man or should it be the woman? I won't give my personal opinion, but I think the woman think that the man should always take the lead. And that's what I'm just guessing. Yeah? Studies have also shown that 43%, and this is telling, 43% of women complain versus 31% of men. So what is really happening here? So the women are complaining more than the men, or is it a testament to say that more women are having problems with their sexual health versus the man? Is that what this is? Is that our understanding? You were saying you had a response there? Oh, I'm sorry, I was getting some responses in on this. Okay, so some persons are saying that the man should take the lead, and some persons are saying that the woman should take the lead. And so I guess, 50-50, some persons, people have different opinions, and there's nothing wrong with that. But another question that I'm going to pose is, do men ask for sex more than women? And I would like to get what your opinion is, which one do you say? Do you say that men ask for more, or women ask more? I just want to see your responses. All right. So looking at some of the messages, all right, I see that some persons are saying that, okay, I'm sorry, I didn't realize that you guys were saying that the audio was not that clear. Sorry about that, but I just see the message. So the question was, do men ask for sex more than women? And some persons are saying yes, and yeah, somebody just said that we are cultured to ask. We are cultured to ask for front. um, and some persons are saying yes, the man should take the lead. But I feel like it's the man them. We saying confession is good for the soul, seriously. but yeah, we are cultured in such a way that the women think that men should go and take the lead. So I don't want to get any trouble here, but I'm just saying that the culture that we have, and we spoke about culture earlier, we're in a culture whereby women, if a man not going after a woman, then the woman will think that something is wrong man. Okay? And we also, if a man realizes that a woman maybe looking, then he's going to think a way about that woman. And if you think about it, men, if you look at in animal kingdom, you can see that let's say for example, the lion is like a hunter, and he's always hunting, if you want to call it like that. Again, I don't want to get in trouble, but I'm just saying that if you look in the animal world, that with the lions, they're always hunting, they're always looking, so to speak. And so, so we are cultured in this way that as we should always be looking, all right? But that might not necessarily be. So I don't know how you feel, but based on responses, that you're saying that the man should take the lead. And so, as somebody said, biblically speaking, the Bible makes it clear one must always yes, one should take the lead, and so the man should take the lead. So let's say it. So men, you should take the lead. So most persons are saying that the man should take the lead, and so men, you have a responsibility to take the lead and ensure that the women are sought after. Okay, and that can pose a problem also, because the man keep looking, then he's going to keep finding. And I'm sure you don't want the man to keep finding. So women, hold on to your man. Alright. What are some medications that can be taken to improve your sexuality? Okay? Alright, so that is something that I'm sure persons would like to hear about. So let's look at it then. What could affect the man, or what could affect the woman? Alright, so for men, erectile dysfunction is a major player that may affect us as men. Okay? There are medications that we can give to help the man. And we know them. We know them as Viagra, we know them as Cialis. We know these medications that can help. Okay? Now, as regards to who can get it and if you should get it, is another discussion that you should have with your doctor, that you should have with your pharmacist. Alright? Because sometimes you may not necessarily need these medications, but because of certain factors that are affecting you, as we stated earlier, in terms of if you're stressed, if you're depressed, if you're hypertensive, if you're diabetic, if you have any of these conditions, it may affect your sexuality, and that is definitely a fact. Okay, if you as a man andropause is going through andropause, then that will definitely affect how you respond and how you respond to your partner, because there's a lack of interest from your side, and so you want to address that issue. All right. So therefore, what medications can you take? Well, as a man, to treat those other problems, then there are certain vitamins that I will recommend for you as men. So what are some of these vitamins that you can take? There are vitamins such as, you can write this down, there's a vitamin such as Arcalian. Arcalian is a very good vitamin that you can take that will help you as a man. There's also this other vitamin named Testojac. Is another vitamin that you can also take to help you, because if your body is tired and weak and dreary, then of course you need to improve those vitamins that you're taking. So Testojac is another vitamin that you can take. There's also another vitamin by the name of Wellman that I would also recommend for us as men that you should take. And I'm not trying to be biased to to anyone, but just from my knowledge as a pharmacist and from what I know, these are some vitamins that I would recommend for you to take. Of course, there are the roots that a lot of us are drinking. Well, if you want to call it the baba roots and all of these things that you're taking as men, that we drink these things. Some person will say that then drink Magnum. So these are tonics that you take, and you blend up your all of your guineas and peanuts and all of these kind of stuff. You blend up these things and to say, yo, listen, this is how I'm back weak, I say back weak. So you go into all of these kind of blends. Okay? Women, this question has always been asked. Can a woman, take Viagra? Can a woman take any of these medications that men also take? Suffice to say that yes, you can. Okay. However, you need to seek the advice of your doctor, seek the advice of your pharmacist. Additionally, for women who may have low libido, there's a vitamin that you can take. The name of that vitamin is fenugreek. So you can go to your pharmacy, speak to your pharmacist, and ask them about fenugreek. That is a vitamin that you, as women, can take. For some women, you might be going through menopause, and some of the time you may have painful sexual experiences. And so because of that, you get withdrawn and not interested anymore. So in those cases, I would definitely recommend that you get lubricants that can also help. What lubricants you can use, there are many of them in the pharmacy. Speak to your pharmacist about these things. Alright? Never be ashamed to talk to your pharmacist. Once you have that relationship with your pharmacist, I would recommend that you speak to your pharmacist about these things. Alright? So these are medications that are available for you or patients that will help you to improve these things. However, let me repeat the fact that we should look at the factors that were stated earlier, the disease conditions, the stress, the depression, the persons who you're taking advice from. Look at all of these factors. Are these factors affecting your sexual health? Ask yourself that question. Are these factors affecting my sexual health? If these factors are affecting you, then you need to address those factors also. The vitamins, medications, and all of these things are part of the treatment, are part of those what can help you. And so we welcome, so you should always speak to your pharmacist. Very importantly, for these sessions that we're doing, we want you to understand that your pharmacist is the one that you should always ask these questions. Of course, ask your doctor, but your pharmacist is so easily accessible. So speak to your pharmacist. The pharmacist will give you advice. The pharmacist will tell you what to do. The pharmacist will give you good advice. Okay? So I recommend that you do this. Do these things, and it will definitely help you. Alright? So, if you're going through menopause, there are medications that you can take, okay, that will help you. There's black cohosh that you can take that will also help to improve or get rid of the mood swings and the hot flushes that you may have. And this, of course, can affect or may affect, your sexual health. And there's also the evening primrose is another vitamin that as women you can take that will help. And of course you can take both of them together. You can take the black cohosh and the evening primrose together. Also, there are other hormonal therapy. There's Premarin that you can also take that will help, to help those mood swings that you may have. And so there are several ways we can help to treat you or to help you that you may be going through these kind of problems. All right. But the important thing is this: if you're having such issues or such problems, don't feel depressed. Don't think that you can't get any help, because the help is there. So speak to your pharmacist and speak to your doctor. Now, we have gone through a lot, and I just want to thank you guys for joining in, who have joined in. And if you have any questions whatsoever, please shoot it right now. We'll take some questions if you have any questions, and we'll try to address those questions that you may ask. So I'm opening the time now for the next 10 minutes for you to ask any question that you want to ask. And once you ask those questions, I will answer the questions that you may want that you have. Yo, listen. All right. So I see a question on the YouTube link, and I see somebody saying that I like this topic. There has to be a part 2, and yes, we will have a part 2, and we'll do it differently. I see one person asking the question that they that means just use a different word, premature ejaculation, and they would want to know what they can do or what they can take to help this. And yes, we do have those situations, and just to let you know that there are creams that are available. So if you go to your pharmacy and speak with your pharmacist, there's a cream by the name of Eros cream that you can use to help you. There's also another cream by the name of Retardin that you can also use to help to prevent these premature ejaculations. And so I would recommend those creams that you can use. So for men, so what you will do is apply this cream maybe 20 or 30 minutes before any sexual interaction, and then that cream will prevent you from having this premature ejaculation. So the name of the cream is Eros, E-R-O-S, and there's another cream by the name of Retardin, R-E-T-A-R-D-I-N. So these are the creams that you can use to control or to prevent premature ejaculation. questions out there? Is there any question from the Zoom link? Alright. See that there are no more questions. I would just like to use this opportunity to thank everyone thank you guys for joining into this session this evening. And let me know that you know that we continue another session tomorrow evening. We'll be speaking about gastritis. I mean, it's Christmas time, or Christmas time is coming up, and so we tend to eat or overeat during the Christmas time, and so because of that, we get stomach problems or we get stomach aches, and these little issues come up. So we will look at that for tomorrow and see how we can prevent this from happening, or what do we do if this does happen to you during this time of the year. I would like to also use the opportunity to let you know that you can also join me tomorrow on Mellow FM 81, where we have our radio show, our radio feature, Parliaments, which you can join us at 2:45 p.m. on Mellow FM tomorrow. Additionally, I would like to also let you guys know that as part of the Pharmacy League recognition from Gateway Pharmacy, we also are having a gospel concert on Saturday at 7 p.m. right here at Gateway Pharmacy, 3A Caledonia Road, where the gospel concert is entitled Jehovah Rapha, God My Healer. So as pharmacists, we give medications to make you get better, but we also bring in spirituality to your healing. And so come down to Gateway Pharmacy on Saturday, 7 p.m. and experience this joyous time of Jehovah Rapha. We're having a lot of great artists on show. We have John Mark Wigan, we have Kira Sales, we have Trishan Smith, we have Fabian Wright, and we have Trezeguet. So, guys, we have a lot of things going on here at Gateway Pharmacy. Don't miss out on these events. Be part of these events. I'm going to ask my technical person to bring up the slide to show you our lineup of artists for a gospel concert. But again, thank you for joining in to our online or patient education session. How can I improve my sexual health? And so we continue tomorrow evening. Thank you again for joining us, and have a good rest of the evening. Oh, before we close out though, I see someone asking the question, why is it so hard for some women to climax? You don't know? Yeah, so let me answer this question. Why is it so hard for some women to climax? No, this is an ongoing issue that we get, that I hear about, and I've spoken to some of my doctors about this situation. And just to let you know that we have a cream that can help you women also, specially compounded for women, and it is available at Gateway Pharmacy, whereby it will help you as women to climax. And the name of the cream is, as the name suggests, Scream Cream, something that we specially compound and is available at Gateway Pharmacy to help you. Now, why do it's so hard for women to climax? Could be for several reasons. Again, maybe your partner that you have could be one of the reasons. It could also be that your state of mind that you're in during sexual activities. And so those are maybe some difficulty that you may have that make it difficult for you to climax. However, as a pharmacist, I would also recommend the screen cream that you can use to help you women that may have that difficulty to climax then, okay? So, ladies, we have a solution for you, so you can always ask us and we will help you to get it. All right, so with that said, I've answered all these questions. I don't see any more questions coming in. I'm not aware of any more questions, but you can still send your questions, and when we open our presentation for tomorrow, we'll address those questions that you may still have to ask. But thank you again, and thank you everyone for joining, and we continue to share this way for you to learn and to get knowledge about medications and about different disease conditions that you may experience. Thank you very much for joining again. I'm signing off for this evening, Dave Thomas. Thank you for joining the Gateway Pharmacy Patient Education Session.